We are going to call to order today the Cincinnati Public Schools Health and Safety Committee meeting. Welcome, everyone. We do have an abbreviated agenda today, so we are going to very quickly go through introductions of the committee members. Rob will give any instructions for a hearing of the public, which is very brief and abbreviated today. And we will go right into our agenda with presentations. We have 3 awesome presentations today. Let's start to my left with our Vice President.
Good afternoon, everyone. I am Mary Weinberg, Vice President for CPS School Board, and I'm so happy to be here today for the health and safety. Look forward to the agenda.
Hello, everyone. I am Board Member Kendra Mapp, and I look forward to the agenda as well. And thank you all to all of the presenters.
And we have our staff here.
Hey, good afternoon. Derek Little, Chief of Staff.
So let's go right into it. Rob, can you scroll down for me? Oh, Rob is our tech person and wonderful tech, and he's going to give any instructions if you do want to have a comment during hearing of the public. Rob, can you share that? And then we'll go right into what we're talking about.
Sure. If you'd like to speak during the speaking of the public session, please click the hand icon and we will ask for your name and school association. And then at the end of the meeting, we will invite you in to speak. Please unmute your camera and your microphone at that time. Thank you.
Great. So the first item on our agenda, Rob, can you scroll that down for me? I just don't have a hard copy. Oh, yeah, thank you. Never mind, I have one. So let's start. Mental health. Dr. Little.
Thank you, Dr. Moffitt. 4 quick updates here. We'll start with the mental health one. If you can go forward a couple slides, Rob. This is really just an update on what we discussed at the last meeting in February, starting with our progress of implementing House Bill 123. Let's go forward one more. I shared data with the committee last time, which is this top level row on where we were in terms of student participation in these 3 topics: social inclusion, safety training and violence prevention, and suicide awareness and prevention. As a reminder, this is the first year that we and other Ohio districts are required to provide this programming for 6th through 12th graders in the district. Just wanted to share where we are as of April, about a week ago in April. So huge increases in safety training and violence prevention, as well as suicide awareness. That makes sense because we've spread them out over the course of the year. And so we'll continue to work on this implementation until school end, gathering some feedback to know how to make improvements here for next year. The other quick thing on the next slide related to mental health, I just wanted to share the latest data through Q3 from MindPeace. We will have a much more thorough update on this in the fall for the full school year. But as we stand at the end of Q3, we are on track to meet and possibly exceed the number of referrals and students in treatment last year when we think about our mental health providers. So again, in the fall, we'll be able to go deeper and understand sort of what they're being referred for in general, how many are being served, what that looks like in terms of outcomes, but wanted to just quickly share the status update. And then Dr. Moffitt, I wasn't sure if you wanted to pause on each one or go through all of them before we handle questions.
Let's have the board members ask any questions that they may have around mental health. We're good? We're good.
All right, the next one is related to the code of conduct and discipline. If we go forward one more slide. You saw the exact same slide at the last meeting. This has been updated though to include Q3 data. So it compares last year through Q3 to this year through Q3. The big graph on the left is the summary by category. So you see categories 1, 2, and 3 there. We are very happy to say that we are seeing declines in the equity gap across all 3 categories. And as a reminder, that means we're comparing students of color and their discipline rates to white students in the district. And eventually we would want to see that gap be 0. So there's no disproportionate discipline for students of color. So definitely moving in the right direction here. The smaller 3 graphs to the right of the slide break out each of the categories. Last time I told you that we were getting benefits from one of them by going in the wrong direction, meaning white students actually had more discipline. And so that helped reduce the gap. In this case, we actually see that we're moving in the right direction really across the board. So category 1, 2, and 3, both white students and students of color are going down. If we go forward one more slide, we'll see some data on the Promise Center on the left. Again, this is through Q3 data. Happy to say that Black students and Hispanic students are seeing significant decreases in Q3 comparisons, but we also see that decrease across the board. So this means fewer students are actually causing disciplinary offenses that would lead to a Promise Center assignment. On the right, something for us to be cautious about and pay a bit more attention to if this trend holds. But students with an IEP saw a slight uptick year over year in terms of disciplinary offenses, and that's specifically for Category 2. As a reminder, we're looking at Category 2 because that aligns with the goals and guardrails, but that's also really the level of offense that can start to lead to exclusionary consequences. So we want to be aware of that. Then the last update here for the Code of Conduct goes back to our Cohort 1 restorative practices schools. Again, this is all of our Title I high schools plus 3 or 4 elementary schools that generally had higher disciplinary incidents historically. We continue to see early signs of impact here, where for Category 1 and 2, we see fewer year-over-year offenses at these 17 Cohort 1 schools. What's in the green box is specifically looking at late fall into the early spring semester, where we can see some noticeable change. We do continue to see a slight uptick in Category 3, but remember, just like last time, these are all in the same scale. So the Category 3 offenses are much smaller in terms of the overall proportion of disciplinary offenses, but we're obviously working with the schools and paying close attention to how we start to reduce that as well. And that's the discipline update.
Do my colleagues have any questions? Yes, Board Member Matt.
Yes, thank you, Dr. Little. I have one question as it relates to the mental health component. So we're recognizing that more students are receiving treatment as well as referrals to receiving supports. And I want to connect that to the discipline. We know that the discipline is going down. Has there been any, I guess, connection to the two to maybe identify that maybe the mental health supports and resources are helping to bring down the disciplinary rates?
Yeah, that's a really great point, Board Member Mapp. I think anecdotally, we would say that there's some connection because we know there were schools last year that didn't have their mental health therapist position filled, because that's certainly a challenge across the country right now. Those schools have come on board with the mental health therapist, or students are getting community referrals for mental health this year, which has been a great practice with MindPeace. And I think we've heard those stories. We can't show that yet in the data, and that's part of what we want to look at after the first full year of restorative practices to see those connections if they exist.
Thank you, and that's all that I had. So.
Vice President Weinberg. I do have a question, but I think in the best interest of time, I'm going to ask it and then have it just be presented at a later date. With regard to the decline in discipline with respect to the equity gap, I'm curious if the numbers that we're comparing, because we're comparing Black to white, and I'm wondering if we're comparing, because of the population difference, are we comparing Black students, like the data from previous years
yeah.
instead of the comparison of Black to white, because the population is varying? So that's just something I have to formulate that question more accurately, but just to give you a heads up that I'm curious about that.
I'm with you on what you're asking. And
Okay.
the short answer is it's within group comparisons to
Okay.
avoid the differences in population sizes.
Okay,
Yeah.
okay, thank you. You'll get a more formulated question a little
right.
later when I have less on my mind, but for sure, that's all that I have. My colleagues have anything else? Okay, let's keep it
All
moving.
right, let's go to the next one, which is an incredibly hard word for me to get right. Venereal disease and
Hopefully
sexual
we never have to
education
get it right.
update. All right, just a quick sort of framing here. This is really on the agenda because each year the state requires us and other districts to submit an audit for whether we are complying with the law around venereal disease and sexual education instruction. What's on this slide, these 4 big buckets, from you have to provide instruction all the way to you have to excuse students if their parents do not want them to participate, are the core requirements in the law. CPS is complying with all 4 of these requirements. We have been, and on this year's audit, we will say that we are as well. The next slide gives us a sense of what we're really reporting to the state. This is pretty basic. simple form. They only ask us 3 questions, which you see on the left. Who we are we providing the instruction, and does that comply with all the requirements of the law? Our answers to those are yes. On the right, you see that for the 22-23 school year, the last time we had to submit this audit, we were compliant in all 3 areas. The big reason why we are compliant is because our board-approved curriculum, Goodhart Wilcox, does meet those requirements in the law. And then these are footnoted. If you want to pull up an example, we can. We provide parent notice at every grade level. So, K on up gets a notice every year saying, hey, your child will receive instruction across these topics. If you do not want to participate, simply send this form back and the school will make arrangements for your student while that is going on. So we are in full compliance with this. We'll continue to be. We must submit our responses for this school year by August, and happy to share an update later next school year with what those results are.
Any questions, colleagues? Okay,
I have a quick question.
yes, ma'am.
So in regards to the compliance piece, when you're collecting the permission slips or whatever the form is called, you said it's available to all grades?
It is. It starts in kindergarten because we're required by law to provide, obviously not sexual education in
Right.
kindergarten, but some topics related to safe relationships and those sorts of things.
And so my question would be, for all of our schools that we have in the district, is this form going home to all of the particular students in schools? And if they are being collected, who's collecting them and who is able to show how many we've collected if parents have opted out?
Yeah, they do go home to every student. They are also available in multiple languages. We default provide them in English and in Spanish, specifically for our schools that have high populations of Spanish speakers. I think there's actually 3 other languages that we translate them in as well. The school does the collection. So there's somebody at the school that sort of oversees the implementation of this work for that campus, and they collect the reports back. It's a bit different than the House Bill 123 data I showed you earlier, where that's being turned into the district level and we're tracking the opt-outs. On this, the schools maintain those records.
Thank you.
Okay. Next quick topic.
All right, last one here is just a quick update on athletic trainers. The first slide just gives us a snapshot of where we were this year. As a reminder to the committee, we had 3 partners, Walton Mobile, TriHealth, and Mercy Health, which have provided athletic trainers to our students this year. You can see the schools that each of those partners are supporting, how much we're funding for each of those partners, and the number of athletic trainers provided. So we were at about 8.5 athletic trainers total this year, depending upon sort of where vacancies were. A couple updates on the cost. Mercy Health has had a grant for some time. That grant is actually expiring. So you'll notice this on the next slide, but that's why their cost is at 0, and then they continue to cover Taft. TriHealth for some time has also covered Walnut at no cost. So the 124,800 that we're paying for TriHealth is really the cost for Clark and Withrow, since we do not have to pay out of pocket for Walnut, and then the same for the Mercy Health schools. Next year, we're very happy on the next slide to be able to expand this and start to work back into a deeper partnership with Cincinnati Children's. We have been working with them really since late fall to talk about what this could look like for next school year. And are working to bring on board 2 athletic trainers with them, which would cover 4 schools. They, like all of the partners, are facing the same challenge with hiring athletic trainers. I think you'll hear that in the presentation a bit later as well. But we have been able to make sure that every school exists with one of these partners. So even though Mercy has lost the grant for those 3 schools, Walton has agreed to sort of pick them up for the time being. Our goal here, which all 4 of these partners are aware of and supportive, is to eventually get back to a place where Cincinnati Children's is the sole or almost sole provider for athletic trainers in the district. Happy to answer questions on that.
Yes, ma'am.
Have a couple of questions. So looking at this particular slide, can you go back to the very first one, please, for a second? So we have Walton Mobile, you have 2 athletic trainers being provided for 6 schools. And then go to the new slide. So now it's saying that we will still have now maybe a possibility of 4, but still only 6 schools. Can you tell me a little bit more about Walton Mobile? And I'm seeing here that we have so many schools, but not enough trainers. So how is that possible with all of the sporting events that they have to kind of ensure that everyone or at least the student athletes are getting the services that they need?
Yeah, as we've shared in previous committee meetings, there is a rotating schedule that athletic trainers use. So they prioritize contact sport games, and then they prioritize contact sport practices. In the event that an athletic trainer is not on site, which has been the case not just this year, but in years past when we did not have a dedicated athletic trainer to every school. Someone at the school is generally providing that preventative work, so taping athletes or those sorts of things. Walton is going to work very hard to get 4 athletic trainers if they can hire them. And again, I would underscore that there is a hiring challenge for athletic trainers across the board.
And you said someone would tape. Who would that someone be? And is that someone trained?
The someone is trained. The schools are working that out with their athletic directors, sorry. So it may look different for each team or for each sport, but that's sort of worked out between the coaches and the ADs.
So I'm going to ask my questions, and again, in the best interest of time, I'm going to kind of allow them to be reserved until maybe our next meeting. We can put this back on the agenda and maybe invite some more information. I have a question. I have a concern around equity for training athletic trainers when there seems to be such a disparity in cost and the ability to secure trainers, and some trainers are not taping or they're doing other things, and it's not clear to me who is doing that. So that it remains a concern to me for equity across our athletic training department. And then also with regard to Walton trainers, I see that there's a huge difference in cost. I'm concerned about that. And then also the quality of what they're providing. The last 310, they're actual health providers. I'd like to see any type of survey data from customer service, like what have we done to measure the quality of service by Walton Mobile? Again, I'm not necessarily focused on them only. I'd like to see the quality of service across all of them, but I know what Children's has brought to the table because they've reached out last year and said that they wanted to maintain service, and it was an issue of funding for the past few years. But these are some concerns, and I'll definitely send you my questions because I have some concerns around equity for our students, that they're getting quality trainers, they deserve quality trainers, and that all of the providers are indeed providing that, but then it's consistent across the board. So I'll put those in an email, but they're coming because I do want to ensure that we're paying almost $400,000 to a quality provider. And I'm not saying that they're not, but I'd like to see, since they've been with us now for 2 years, what has been the response rate? How many students have they seen? What has been provided? And I'd like to see that from all of those schools that are listed, and especially the ones that they've already provided services for. Do you have any questions? Okay. Anything else, Dr. Miller?
Happy to respond to those questions when you send them, Dr. Moffitt. I can also reshare what the fall committee saw, which is the current schedule and coverage for each of the schools.
Well, I think I'm looking a little deeper than that. I have no doubt that those games are covered, but I'm looking for the quality that they provided when they were there, just as I would with any other vendor. And I actually am very curious about Tri-Health, Mercy, and Children's.
Yeah.
What are our students that receive that service actually saying about the service that they received? And is there disparate treatment between the 6 schools that are being provided by one provider versus the 4 from another? So again, we have an equity policy that needs to be maintained. I want to make sure that all of our students, regardless of their school and their insurance, are actually getting quality service. And the only way for us to do that is to collect that data. So hopefully, I'm pretty sure you all have done that. I want to make sure that the board has seen it so that as we do look to be efficient with our contracts for fiscal purposes, that we are indeed giving the best to our students for sure.
Yeah.
So I want to move on. Was that it, Dr. Little?
That's it for me.
Okay, we do have 3 presenters. Next on the agenda, joining us virtually is the CEO of Prevention First, Nicole Scheisler. I hope I pronounced that right, Nicole. Did I pronounce that correctly?
It's fine. It's Schisler, but it's fine. Thank you.
We can't hear you.
Can you hear me now?
Very low. I think Rob is turning you up. Yes. So as a part of one of the board responsibilities, we have a liaison to the Hamilton County Addiction Response Committee, and the committee heard some data, a student survey from Prevention First, and you're gonna get the presented skeletal version, but we have Nicole to share just some high level findings, but the board committee, the committee has received the full presentation, and I will forward that to all of the board members, Nicole, so that they have that information, and to the administration. And hopefully we can get some of our students involved in this survey, because they don't have any CPS schools as far as I know, but it's on you. You got 5 minutes.
Okay. Did you want me to share my screen or just speak? How would you like me to do it?
We have the survey up. I think we have what was on board docs. Can you see it? Are you able to see it?
And thanks, Rob, and hi, Rob.
He's waving.
He used to be on our board and was with us for several years as our IT person. So it's good to hear his voice. I know it was him. Are you just going to advance my slides, or did you want me to? Okay, here we go. Okay, next slide. I will just do, Dr. Moffitt, a quick overview of who we are, and then I have some highlighted slides I'd like to look at. So Prevention First is a 501c3 organization founded in 1996, and we implement best practice strategies to reduce the risk of behavioral health disorders. We define behavioral health disorders as mental, emotional, and behavioral well-being. So we are focused on substance use prevention and mental wellness. It is our vision that all communities apply prevention strategies in every stage of life, and we really do focus to bring prevention to across the lifespan. And originally founded in 1996, as I indicated, we serve the tri-state region. So we serve the entire state of Ohio, but then some of our funding goes into two southeastern Indiana counties and 3 in northern Kentucky. Next slide, please. When we think about prevention, some of the ways and the key areas that Prevention First focuses on is to ensure data-driven decision-making. We support community engagement through our ability to build community coalitions focused on substance use and mental wellness. And we implement evidence-based prevention by building and strengthening capacity across all community sectors, loosely defined as faith-based organizations, schools such as yourself, law enforcement, youth, faith-based are just some of the examples. And next slide, please. So the full slide deck that you've been giving is what we call the regional findings. So within the survey cycle, which was administered between September of 23 and December of 23, this is our 13th cycle. We do this every other year since 2000. So we have rich data to look at longitudinally across multiple counties in the state of Ohio. Indiana and Kentucky do not participate in our survey because they have their own state surveys. So 15,756 7th through 12th grade students from 38 schools completed the survey, and respondents from public and private schools across 3 counties in Southwest Ohio. So just a quick speaking point on that. Of the 15,756 7th through 12th graders, 3,134 were from Hamilton County, and of those 3,134, 771 were Cincinnati Public Schools. So 2 schools participated from your district, which made up about 25% of those that were included in the survey. So like Dr. Moffitt said, we would love to see an increase in those schools. And I appreciate seeing Dr. Little. Thank you so much for your help in getting the schools that did participate. And I think we could most definitely do it again. I wanted to quickly go over, if you could advance to slide 11, which is titled Prevalence of Use. The documents that we gather, or the questions that we gather, are called the National Outcomes for Substance Use. So we look at prevalence of use. So you can see here that the most prevalently used substance is vaping. And then it's followed by alcohol, marijuana, cigarettes, and prescription drugs. If you advance down to slide 15, please, perception of harm, the students are asked, how do you perceive harm among your peers? And so that is the perception of harm there. And As you can see, there's the perception of harm here is definitely the lowest amount that students perceive harm as marijuana. And once we continue to do our survey summaries for the year, we just got this data here just about a month ago. I can send the Cincinnati Public School reports as well as a one-pager. And if you could please go down to perception of parental disapproval, which is slide 17. This is another core measure. And we are asking the students, would your parents disapprove of your use of marijuana, or I'm sorry, of these substances? Would they find it wrong or very wrong? So you want these numbers to be high because then that means the students are perceiving it as harmful. And so you can see here that the least harmful substance that they perceive is definitely alcohol. And then just for the sake of time, I would like to go down to slide 24. There is a lot of questions that we've added throughout the course of time that we call mental health markers. And so some of these are, the students are asked, have you ever thought about attempting suicide? And this report is combined as the percentage of those who said often and a lot. So some of the things that the suicide ideation was at 7.9% of students in the region. And then those that answered all or most of the time looked at anxiety, depression, and isolation. So those markers that we know have the potential to impact mental wellness. And if you could please go down to slide 27, and I just wanted to point this one out as well. And that looks like, some of the things that they're asked are, what are those factors? Let's see, hold on. How often are you using screens outside of work and school on average school night? And then a couple of cycles ago, we started asking students, how often are you playing video games to the point that it's negatively affecting their health? So you can say, how often do you experience stress? Often or a lot, 47.2%. Treated badly, unfairly due to race or ethnicity, 8.7%. Screen time, how often? 54.3%. And then video games affected school or work, and that's 14.2%. And I am at 7 minutes, so I'm going to go ahead and conclude here. But on a positive note, the slide 33 does show some of the key factors that we know create a positive school climate, and that students help each other when they are hurt or upset. At least one adult in my school really cares about me. Teachers help students cope with stress, and teachers in our school tell me that it's okay to have my feelings. So that is slide 33 that I'm ending on. And these are just some of the indicators that we know matter in a school climate. And I just wanted to end there based on what Dr. Little presented just a little bit ago with some of the mental health areas. The last slide in your slide deck has my contact information, and I'm happy to share. I'm also happy to come back or even just send documents when we can better summarize the Cincinnati Public School data for these very specific questions. We're just not there yet, but there was, as I mentioned, a total of 771 students. So I will stop talking there because I am at my time.
Thank you so much, Nicole. I know some board members do have questions, but we will send them to you and invite you to come back one more time to our next health and safety meeting, because I can just tell board member Mapp is like, wait a minute, hold on. She's holding back. She's holding back. I can tell. But thank you so much for presenting. You gave a really brief presentation, and I was at the meeting, so I know that there's a lot more that you could cover. I want to reserve that invitation to you and extend that. But just so you know, the board committee members do have the full presentation.
That's correct.
Them. And I will send that and forward it to all of the board members so that they have it as well. And they may have some questions too. Thank you so much.
And they also have the regional summary of the data that I did. That regional summary does not include the mental health factors, but that's something we can certainly do across the next year. There's just, we do a little bit each month as the data comes in. So more than happy to give anybody anything they want, especially in regards to like, what does this look like for next steps? What can the students do or the administrative or school board do with this data?
Got you. Thank you so much. Appreciate you. See you soon.
Thank you. Okay.
Our next, I skipped over our athletic training update from Mrs. Grimes, Activity Beyond the Classroom. Come on up. You have 5 minutes or less, and I apologize for the brevity of this, guys. I really apologize. And I invite everyone to come back during our next meeting and get your full 10 minutes to 15 minutes for presenting. Mrs. Grimes.
Is it on? Oh, there it is. Okay.
There we go.
Hello, thank you so much for the invitation to be here today to give you a little bit of history about athletic trainers in Cincinnati Public Schools. If you could go to the next slide. Just a quick history about why ABC is a part of this. Our mission is to help students succeed through extracurricular opportunities. And we have been for about 12 years now, since 2012, we have had a contract with CPS where we manage, employ, and support the athletic directors throughout the district. So that's why we are involved in athletic trainers as well as through our employees, the athletic directors in the district. Next slide. So just a quick overview of what an athletic trainer does. I won't read through all of these. Most of it is pretty common sense. They're instrumental in taking care of our student athletes and their physical health. I do want to point out the last item on here, which is one thing that we know is athletic trainers also support students' mental health quite a bit, and athletes form deep relationships with their trainers, and they're in a safe space when they're being treated. And we've learned that they open up to athletic trainers about situations at home or in their personal lives. So these are also important adult mentors in their lives. Next slide, please. This slide goes through the history of trainers in Cincinnati Public Schools. And you can see that prior to 2013, trainers were always hired game by game. And it was in 2013 when Children's and ABC began collaborating to provide trainers at Withrow and Clark. And this was through outreach funds that Children's Hospital had, so it was at no cost to CPS. Over the years, we worked together to add more trainers. And you can see in 2019, we got to a point where every school had a trainer through Cincinnati Children's. In 2021, Mercy Health joined and is what began helping, as Dr. Little shared, with some of the other schools. What I wanted to make sure to point out there is that in 2021, Children's did share with CPS and ABC that outreach funds would be depleted. And after the 21-22 school year, there needed to be a new plan. So there was a 1-year runway to put that plan together. Unfortunately, that plan did not happen. And so with no outreach funds available, Children's had to drop out of providing athletic trainers. So you can see that that was in 2022. Next slide, please. I won't read through this one, but this is our history of our agreement we had with Children's regarding trainers. The one thing I'll highlight is the dollar value that they brought in 2018, 2019. It was 1.4 million, which included the cost of athletic trainers, but also everything else that you see here, the rehab and the modalities and the testing costs. Next slide, please. Some of the challenges, which Dr. Little also mentioned, are that there is a national shortage of athletic trainers. So everybody's having a hard time finding high quality athletic trainers, no matter what city you're in, no matter what district you're in. A challenge with trainers is you need to have a multi-year partnership or contract in order to hire and maintain the highest quality trainers. An entity like Children's Hospital can't hire a trainer for just 1 year. So there needs to be a multi-year partnership to make sure that those trainers can stay in place. And in addition, because of the shortage and because of the skill required of trainers, there needs to be a nice runway in order to prepare for that. So to have trainers in a year, we need to be putting a contract and agreement in place now so that the provider, such as Children's or some of the others that were mentioned, have time to find those people, recruit them, train them, onboard them, and get them ready for the beginning of a new school year. I wanted to make sure to point out one thing we've noticed in our role as supporting athletic directors and athletic trainers is that the unfortunate reality is there is a funding inequity when it comes to trainers. The insurance payer mix at schools with a higher socioeconomic status attract the providers because the providers can then see an ROI. The schools with a lower socioeconomic status do not attract those providers, which is why most of the schools do not have free trainers, because the providers would not be able to see an ROI on those other schools. It creates a real inequity in our district. Next slide, please. I have more information here that I can share with you, but I just wanted to let you know that we do have data from our athletic directors regarding trainers in the last year. And as part of, again, our role in managing the ADs, we want to make sure we are supporting them as well as we can. So we survey them to see where they need additional support. Athletic trainers is definitely something that came up on their list as needing more support in getting trainers to be there consistently. And next slide. So looking ahead, my understanding is that we do have trainers confirmed at Walnut Hills and Withrow by TriHealth. Taft will be covered by Mercy through the FCC partnership. And then other schools currently do not have a contract or any trainers assigned to them. I shared with you, and I will not go over it now, some of the documentation from Children's of what that would cost to have trainers throughout the district. So I believe it is up on board docs, but if you have questions about that, I am able to answer those as well. I hope that was fast enough.
That was quick. Thank you so much. I'm sure my colleagues have questions. I know they do because this was not my topic, but we're going to reserve them and send them to you and invite you to come back on our next meeting. I apologize for that.
Sounds
but
great.
the
No
bo-
problem.
Just to remind everyone, there is a full presentation on board docs. The committee members have received your presentation in entirety, all of it. And then I will send those to all of the board members. Thank you.
Thank you. And feel free to reach out if you have additional questions.
Okay, thank you. Last presentation, very quick. It's kind of probably my fave. I should have you guys go first. Our students from Xavier University, and they are going to present quickly. And again, I'm going to invite you all back again to come back.
That's fine,
in
that's
June.
fine. As you're receiving right now, the same paper pamphlet of what all this is on the board. But in the interest of time, I'm gonna go ahead and get started. So my name is Mariana Ty. These are my colleagues, Faith Wright, Nicholas Buzzkirk, Emma Pittman, and Chantel Johnson. We are all students of Xavier University, and as a part of our program, Philosophy, Politics, and the Republic, it's an interdisciplinary honors program. We did some work this semester going to DC and tackling some problems that we thought, not only that we've seen in our society, but in the world, on our nation, and all those good things. And we made sure to take an issue to DC that we were very concerned about and come back locally and want to talk to you all. So thank you all so much for speaking with us. And we're gonna go ahead and get started.
So first, we are going to analyze the previous Health and Safety Committee updates. I'm going to highlight the last two topics, which are mental health and SROs and resource coordination. So the first will be that the Save Students Act calls for 6th through 12th graders to receive annual programming in those 3 mental health and inclusion topics. The first one being social inclusion, the second one being safety training and violence prevention, and the third one being suicide awareness and prevention. There is a significant disconnect between parents' awareness of child's mental health and overall youth mental health experience, which caused that increased need for access to mental health resources. And then for SROs and resource coordination, there is an MOU between CPS and CPD that clearly outlines the function of SROs within the school building. And there are benefits of less SROs and decreased exposure to law enforcement for students.
Yeah, so I got the opportunity to meet with 5 police officers, members of law enforcement, 3 of those being current or former SROs with 5 years minimum of experience, 2 of those being police chiefs. I also got the opportunity to meet with 2 school administrators, one being from a rural district of under 5,000 in population, and one was from a larger city and a larger district. So what I extrapolated in terms of issues from those SROs was a lot of times they recognized that they were not the best person to be in the situation that they were in, or the best person to be conducting discipline for students. In Ohio, SROs are not required to have their training done until up to 12 months after they are assigned to the role. This on top of the fact that this is typically done in seniority in a lot of police departments, where the senior police officers can pretty much pass that responsibility down, often causing the newest police officers to be assigned to that role and having a lack of experience. This combined with the fact that law enforcement, when interacting with mentally ill individuals, are approximately 10 times more likely to act with aggression or violence towards that individual. We just find this to not be the best scenario to put them in. In my discussions with the administrators, a lot of these sentiments were echoed. One told me an anecdote himself about his second year as an administrator, meeting a 19-year-old cop who was assigned as an SRO in a rural district. They didn't have anybody else to do the job. Interacting with a mentally ill 7 or 8-year-old that was just not able to understand what they were telling them to do. And they were just not able to get the problem resolved, and it ended pretty ugly. So for those reasons, we just think some alternatives should be looked into, and also increased training for those who will be in this role.
So CPS has already made substantial contributions to ensuring full school safety that has been admired and followed by other school districts. The first contribution we have is MindPeace Mental Health Agency. Through their collaboration with CPS, MindPeace provides crucial school-based mental health support, ensuring schools have access to addressing mental health concerns. Last year, MindPeace successfully connected 72% of students to mental health treatment, surpassing the national average and significantly reducing stigma. Next, we turn to the Promise Center, offering an alternative to out-of-school suspension and expulsion. This approach focuses on providing additional support and instruction to students facing behavioral concerns. Through collaboration between families, schools, and students, the Promise Center creates a positive environment, changing the narrative of the school-to-prison pipeline. By providing academic, therapeutic, and behavioral instruction, it ensures students remain engaged in learning, emphasizing their potential for success. Lastly, in alignment with Ohio House Bill 123, CPS prioritizes evidence-based instruction in suicide awareness and prevention, safety training and violence prevention, and social inclusion. These initiatives equip both school personnel and students with the knowledge needed to address mental health concerns effectively, promote safety awareness, and foster understanding and empathy among students from diverse backgrounds.
I finally want to talk about some actions that can improve full school safety, including implementing violence interrupters, which are trained experts in violence prevention in the community who have close relationships with the children. Second is to hire staff to facilitate full school safety, including school counselors, therapists, or school social workers who can assist children at school, in the home, and in their outside life. And thirdly, to provide students with more holistic mental health and inclusion topics outside of those established in the Save Students Act, such as depression, anxiety, trauma, domestic and intimate partner violence, etc. And if these are already taught, to explicitly say so that the community knows what the students are learning.
So again, we would like to thank you all so much. Our information is on there, but you also have our information. So if at any point you would like to reach out, talk a little bit further, I know we are on short time, we would all appreciate it. Thank you all so much.
Thank you so much for all of this. I know my colleagues do have questions. We're going to reserve the right to invite you guys back. We are not going to do a hearing of the public because we are late for our executive session. Thank you so much. You all did a great job. And our next meeting is in June. So we'll invite you back then. Thank you.
Thank you all.
We conclude our health and safety meeting. Have a good one.